Dear students, this video we are going to discuss about the diagnostic process in organizational development. Organizational development is a methodology to improve the organizational effectiveness. It eliminates various underperforming or problematic areas in the organization. To implement this OD intervention or methodologies, the organization needs to identify the problem area first. Okay, so this is a very important step. Then later they can apply the suitable organizational development intervention. So this process of identifying the problem, studying the problem, and finding out the suitable OD strategies or change strategies is called as a diagnostic process. Diagnosis is a systematic approach to understand the present state of organization. So what is the current level of performance? Is it enough? Okay, what is the desired state of performance expected? Okay, so why there is a gap? Okay, so that is the problem. Okay, so that must be analyzed. Okay, causes of problems must be understood, and based on that they can select the appropriate strategy for the improvement. This diagnostic process should be simple, it should be transparent, it should involve all the concerned parties. Okay, you should focus on only on the main factors. Okay, because you should not waste time. So every minute delay in identifying this problematic area, it leads to a loss for an organization. So they have to focus on the important factors for the problem with a sense of urgency. They have to identify as quickly as possible so that the problem can be rectified. The exact process of diagnosis consists of four major steps. It is a cyclical process, that means continuous activity. First one is data gathering about the various departments, functional areas, performance, okay, over the period of time. Then by analyzing the data you can identify the problem areas where the performance is very low, and interpret the problems and identify the causes of the problems. Third step, then based on the identification of the causes and the problem, the potential strategies to overcome that can be developed and implemented. So the same process explained here elaborately. First one is identify the tentative problem, that means symptoms. Okay, if there is some problem in the organization, we can see some symptoms. For example, say absenteeism, in the employee absenteeism, lower productivity, production is very low, sales declining. These are all some of the symptoms in organization. So these are all the tentative problems identified, and collect the relevant data. Okay, employee absenteeism means collect the data. So how many employees are working, what is the how many people are often getting absenteeism without any information, without proper reason. Collect the data and analyze the data and give the feedback to the data. If more data is needed for getting complete information out of this analysis, collect the additional data that are required. Okay, then you can understand the exact problem areas. Okay, absenteeism one symptom, a tentative problem, but the actual problem may be somewhere else. So why absenteeism happens? Because of job dissatisfaction, a very dangerous working environment, very poor treatment by the organization. There are so many reasons are there. Okay, so you have to identify the exact problem that leads to absenteeism. Okay, then you have to check with the organization whether they are really interested to rectify this issue. Okay, then they can work on the problem, develop a suitable change strategies, OD intervention methods, then implement it, monitor and assess the results, and further improve. So this process continues. Okay, now normally the diagnosing the problem is done in organizational structure, administration, and communication channels, procedures, policies and procedures of the organizations, and other environmental elements. Okay, so where normally most of the problems occurs. Okay, so this is the main objective and process of diagnostic process activity in organizational development.